You might have heard the term epididymal cyst being mentioned in your ultrasound reports, or you might have noticed a lump around your testicles. Many people panic when they hear there are a lump in the testicles. Let me assure you, in most cases, it's not a something to be overly worried about. Let's understand this properly. When a cyst develops due to a tissue growth in the layer behind the testicles called the epididymis, it is known as the epididymal cyst. If the cyst is filled with fluid, especially sperm, then it's referred to as a spermatocele. Simply put, it's like a small water-filled balloon behind the testicles. Most of these cysts are benign, meaning non-cancerous. They are usually painless, soft to touch, and often discovered by chance. In fact, many men live with one and never even realize it unless they undergo a scan for an unrelated reasons. Now, why does it form? Well, there isn't one single cause. It could be due to a past infection or minor injury or even inflammation in a scrotal area that has healed but left a small sac behind. There's no single direct reason. Sometimes it could be due to a minor infection, a small injury to the area, or just natural tissue fluid getting trapped. Think of it like when you get a tiny blister on your skin that doesn't hurt but stays for a while. There's no connection with the genetics, and it's not a sexually transmitted disease or a result of poor hygiene. It's just one of those things that can happen in the body without causing any major trouble. Generally, this is do not cause pain, discomfort, or fertility issues. However, in some rare cases, if the cyst grows too large or presses against the surrounding structures, there might be a sense of heaviness or a slight discomfort. And yes, in extremely cases, if there is rapid growth or changes in the consistency, doctors might want to rule out more serious concerns like tumor. But again, that's not the normal. Now, let's talk about the treatment. Most of the time, no treatment is needed. But if someone is looking for a natural, side effect free way to manage it, Ayurveda offers an effective option. Yes, in Ayurveda, there is a well documented herbal formulation called Kanchana Gugal. This classical medicine is often used in the management of benign growths, soft tissue swellings, and the cyst. It contains ingredients like Kanchnar and the Gugal, which are known for their ability to reduce lymphatic congestions, improve metabolic activity in the tissues, and gradually help shrink such cysts. So now, is there something important? If you have both an epididymal cyst and a varicocele, which is swelling of veins in the scrotum, managing the two together needs especially attention. Why? Because sometimes when you try to treat one, the other may flare up. It's a bit like balancing two sides on a seesaw. That's why it's the best to follow a well-mentioned plan where your treatment is tailored based on your specific symptoms and needs. So overall, if you have been diagnosed with an epididymal cyst, don't stress. In most cases, it's a simple, non-cancerous condition that doesn't interfere with your health or fertility. Be calm, stay informed, and explore natural support options like Kanchana Gugal if needed. There's no need to panic or rush into aggressive treatment. I hope you liked this video, and thank you for watching. Take care.